Hey, this is Marty Stempniak, senior writer for Hospitals and Health Networks magazine, and I'm coming to you from the HIMSS 2016 conference here in Las Vegas, and I am joined today by Dr. Charles Macias, who is Chief Clinical Systems Integration Officer for Texas Children's Hospital. Charles, thanks for being with me today.
Thank you for the invite.
Could you just start, Dr. Macias, by telling us what evidence-based clinical standards are?
So most people think about clinical standards as either evidence-based guidelines or evidence summaries, but there's some product that allows clinical enterprises to share a common path, a common clinical standard, so that they align care in one way. Evidence-based guidelines are probably the most common form of clinical standards work.
Okay. Could you tell us a little about the processes that you've put in place at Texas Children's to systemize these clinical standards?
Yeah, so we have, for about the last 7 years or so, created an infrastructure through the Evidence-Based Outcome Center at Texas Children's Hospital that allows us to create, or we like to think of them as derive, guidelines through a number of different strategies, first beginning with identifying our most common problems, our biggest gaps in quality. We use a very systematic approach to that. We search for existing guidelines to understand how we might evaluate whether what is out there would be useful for us. But most of the time, even when we do find those, we need to contextualize it. We need to make them very specific to us so that they work in our workflow. And then after that period, we typically create bottom-up teams. That means teams that are frontline workers, not politically engaged teams, but skills-driven teams that through a very structured process asks very pertinent questions to the disease process, comes to some agreement for what the evidence can be interpreted to say using global tools to help answer those questions, and then works through vetting those final products throughout our enterprise so that there's a significant buy-in from all stakeholders. That allows us then to build them into our EMR through decision support mechanisms.
Mm-hmm. What were the technology and data requirements for Texas Children's in this process?
Yeah, so much of what we were doing really was, I think, a leap of faith for a lot of the members of our organization, that we had to have very clear analytics behind what we were proposing was the better standard. So it was really about aligning, if you think of a disease process broken up into 7 to 10 core elements that were going to improve quality of care, we needed to be able to provide analytics behind them, and we needed to really provide it in a ideally real time, but in most cases near time. So creating an enterprise data warehouse structure that would help inform the analytics behind it was important, and then subsequently pushing it forward in decision support. So building that into the EMR to inform providers what are the best workflow choices to be able to drive them.
Mm-hmm. Could you tell me what sort of results Texas Children is seeing in terms of rooting out variation and finding cost savings?
Yeah, so we have really been able to identify a huge amount of variation in a number of diseases, and we now have both a qualitative and a quantitative approach to the way that we identify those big gaps in quality, and much of that is driven by recognizing where the variation exists. Once we are able to identify those gaps, then in developing our metrics, we align our outcomes with what we identified as those gaps, and so we're able to capture not just metrics that are aligned against the patient experience, but measures specific to the disease, so clinically relevant components. And then the third component of that are the financial metrics, and a lot of those are centered around length of stay, reductions in variable direct costs. And for those people that operate in the quality improvement space, they might recognize those three big clusters as the triple aim of healthcare.
Just in closing, Dr. Macias, what advice do you offer to other hospital leaders who are just getting started on the journey that you've been on at Texas Children's?
So I think starting small and moving big, we made a lot of mistakes along the way. We often tried to bite off more than we could chew. We started off with developing a number of these guidelines and attempting to implement them without the analytics behind all of them. And so we've become much more sophisticated in integrating our clinical care quality improvement processes with the analytics behind it, as well as our implementation strategies and development strategies for the guidelines themselves. So those 3 systems integration models taught us start small and then grow, link them to outcomes, and develop a very clear governance that allows you to understand where they fit in the prioritization of the organization. And that's been very powerful for us. We've seen length of stay cut in half with a number of different diseases. We've seen our outcomes of care just absolutely skyrocket in terms of improvement. So it's been very transformational.
Great. Dr. Macias, thanks so much for being with me today.
Thank you.
For HNHN, this has been Marty Stempniak. Thanks for watching.